Okay, we are back with another clinical conversation with Matt Lorimer, who is a clinic manager and physical therapist at Cora. We have Ashley Langford, who is our director of clinical excellence at Cora. I'm the marketing guy at Cora, and today we're talking about sports, but specifically we're going to talk about golf. And we're going to start this conversation with a question for Matt that's a real kicker. My question is golf a lifelong sport? Is it something that I can play at an early age and all the way through to my elderly age?
Yep. So yeah, to kick things off, Adam, golf 100% is a lifelong sport. From my experience, my dad introduced me to golf when I was about 7 years old, and I've been playing since. I'm in my mid 30s now, and again, it's something that I plan to play, through until retirement age or and longer. There was actually a study recently in the British Journal of Sports Medicine, and what they found was that in terms of expectancy, longevity, physical health from both a cardiovascular and a musculoskeletal standpoint, that golf was beneficial. That people were being more active, they were living longer, and there was also even benefits for mental health as well in terms of overall well-being and the social aspect from golf. So it's something that if you're a golfer, you're getting the physical activity, you're getting the mental stimulation, and it's something which is beneficial all throughout life.
My experiences with the mental part of it hasn't always been good, but I do enjoy golf. All right. Well, this is, you got my wheels going already, and I'm gonna kind of break it down to, as far as injuries go, kind of common injuries. Is there a kind of like a common injury area that would go from, like, if I'm in my early age through teens, maybe 20s, are there common injuries that population sees, and then maybe right 30 to 40, 50, and then 60, 70, 80? Like, are there common injuries that you see at different age groups?
Yeah, I mean, what you have to look at is, obviously the age of the golfer and the competitive level. They found that, there's certain caveats with amateurs compared to professional or high level performing golfers, where the professionals and high level performing golfers, a lot of the injuries they sustain are through repetitive strain injuries. Whereas on the amateur side, it tends to be more from a poor swing, so more from poor biomechanics, which is causing the injury. When we're looking at age group, from a youth perspective, a lot of youth golfers are going to present with instability problems. Poor core stability. They might present with swings that are kind of more what's considered all arms, where they're kind of swinging from the arms and not with actual kind of core rotation, which can predispose them to potentially more shoulder injuries. As we're getting older, and we're getting into kind of 50s and 60s, the aging process is taking force. We've got compressive forces in the spine. We've got postural issues, rounding at the shoulders, which is kind of closing down the joint space in the shoulders. So then we become more predisposed to low back pain injuries with the rotational aspect of golf. There's a lot of kind of anterior, posterior, and lateral shearing in the spine. And then with shoulders as well, with that kind of decreased joint space, and with the mechanics of the swing, we're getting a lot of kind of compressive forces for the shoulder, which can contribute to rotator cuff problems. And then on top of that, with the general aging process, we've got degenerative conditions, osteoarthritis, things like that are kind of going on in the background as well.
It's interesting at like the professional level too. We're talking about posture and watching golfers. They during the swing, they tend to dip down on that side, so the spine becomes concave. It tightens on that side. But to watch them walk too, like classic image in my mind is Dustin Johnson. So DJ, you've got the repetitive motion, but then you've also got that mix of such mobility with strength. Watching him walk, you can see his spine's like a snake. Like he's got the freedom to move. He's just learned how to really control it and do the same thing over and over again. So they certainly have that dip of the shoulder on the side that they're swinging away from, and then it's interesting to watch some of them walk because they're so free to move.
Yeah, yeah, and as you said, actually, when you look at a lot of golfers, I've attended major golf events in the past. stuff like that. I followed Tiger Woods, Sergio Garcia, and when you look at these guys in the flesh, they're, as you said, they're so good at maintaining that posture throughout the golf swing, that it really does minimize the risk of injury. What we tend to find is from the kind of amateur side is, everybody's swing is different, and there's a lot of biomechanical faults that are going on with different people. So from there, then depending on what the fault is, then obviously there's increased risk of injury in certain body parts.
The swing is kind of changing, right? We have Bryson DeChambeau. You mentioned Tiger Woods, who had, right, he's got real back issues. And when you think of somebody like Bryson DeChambeau and you look at some of these like long drivers, it's all, I think, speed now, right? It's all club head speed. That's what's producing the distance, with some technology, of course. But like with that pursuit of speed, how will that kind of change the potential, like, kind of future of the injuries that you'll see in the golfing community if everybody starts going for that kind of speed? Again, these guys are all over TV, so they're definitely inspiring a whole new population of the way and style people grow up playing golf. How do you think that might change things?
Yeah, I mean, so kind of circling back to Tiger Woods, I'd say he was kind of the first golfer that kind of put strength and conditioning protocols on the map. You look at a lot of golfers in the past, you didn't necessarily have to be in great shape. Certain names come to mind: Angel Cabrera, Miguel Jimenez, Colin Montgomery. Some of these golfers they weren't in the best shape, but they managed to play well consistently. So when Tiger Woods came along, in the kind of late 90s, early 2000s, and you were seeing him, the way he hit the ball, the amount of force he could generate, I think that really changed the game in terms of where golf has went over the kind of last 15, 20 years. But with that being said, what we're finding is, a lot of amateur golfers obviously want to emulate the pros, but if you don't have the mobility or the core stability and you're trying to swing at a tremendous speed, then from there, again, there is going to be increased chance of injury, just with the amount of force generation, and particularly for the spine, the amount of kind of anterior, posterior, and lateral shearing. I think it's a potential recipe for disaster, for increased injuries in the amateur population.
Is that the best place to start if I wanted to ensure? I have two boys who are just getting into golfing. Is ensuring that their core is strong, is that the best place to start as far as injury prevention? And if it is, or if it isn't, what is the best place to start, and where do we go from there? How do you build out from the good foundation?
Yeah. I mean, I would say, a lot of, for a lot of injury prevention, it's building from the inside out, so making sure that we have good core stability is a core fundamental. Particularly for golf, that's one aspect. Another aspect is obviously the mobility required for the golf swing. So we have to have good hip mobility. We have to have good thoracic mobility, where we can generate what's called the X factor. So this is a kind of a term, again, which has came probably within the last kind of 10 to 15 years. So the X factor is basically the relative rotation of the shoulders compared with the hips. And what they find is if you're able to increase the X factor, then from there, then we can get more rotational force. And then that transmits to increased power, which means we can hit the ball further off the tee. And again, this is what a lot of the pros are kind of going after now, is if we increase the X factor, we increase the yardage off the tee. And then the second shot from there, maybe in the past, there used to be a 6 or 7 iron. Now it's a pitching wedge, so then they can be more accurate, kind of getting the ball onto the dance floor, so to speak, for putting. But in terms of kind of youth, where I would start with, a lot of it is just really, you don't want to focus on a lot of this stuff from a really early age. You want to focus more on the technique, so making sure that they have good quality technique, a good quality swing, and then once they have the kind of core foundation from there, then as we're starting to get into the kind of teenage years, and we're starting to maybe play at a higher level, then we're kind of bringing in, the kind of physical therapist aspect and working on all these different areas that we've been speaking about.
Golf is no different to posturally and in our kinesthetic awareness. personally, and I'm sure this goes for a lot of amateur golfers, like what position you think you're in and what you think you're doing, then to actually have it analyzed, you know what I mean? It all of a sudden you realize, ooh, I'm way off. So going back to your kids and at an early age, I'd almost argue if you can maintain that perfect alignment and pick up on speed, chances are your core is developing to match that. Correct me if I'm wrong though, Matt.
Yeah. No, I said I would be in agreement with that. I said if you can teach the kids, good quality swing pattern, and that's something they can do slowly, and then gradually build the speed over time, then I think it's setting them up for success.
I also heard recently that, and I think it was, well, I'm sure it was said before, but I heard it from Bryson DeChambeau, bringing his name up again. But he said, you play from the front. It's not, golf has changed a little bit where the tee, right? It used to be seniors and ladies and men's or whatever. And now it is kind of like it's kind of more around your handicap. And if you're starting golf, you should always play the front. And until you can break, I forget, 90, we'll say, then maybe you move back to the next set of tees and move back. And it sounds like that's kind of the same philosophy to swing speed and strengthening, etc. You achieve a certain place of comfort and skill level, if you will, and then you can kind of move on to the next kind of place in forward momentum.
Yeah, I would agree with that. And it's kind of, obviously we spoke about a lot of the physical aspect, but golf is a mental game. They say that golf's played between 5 inches between the ears. You know, and a lot of it as well is to be able to hold a nice posture, to be able to provide the good quality swing. A lot of it is your mental preparation, stepping up to the ball, making sure that you're in a kind of positive frame of mind. And if you do have a bad shot, it's about how do we get that mental recovery quickly? How do we get back to positive affirmations and kind of visualization that I'm going to hit my next shot 5 feet from the flag.
An exercise not commonly talked about is breathing exercises, right? Do you get into that with any of your patients or training?
Yeah, I mean, a lot of the time, for pain relief, we'll kind of delve into breathing control type stuff, where we're focusing on that kind of expansion of the diaphragm. But again, for that kind of mental aspect as well, for almost like getting the body into a meditative state, where we're getting the body relaxed and we're kind of setting ourselves up for success. I think breathing control is a very important aspect too.
I know I'm working on my breathing when I'm standing over that 8-footer for double bogey to break 150. I'm usually focused on my breathing. Anything else about the swing? If we were talking to an audience of golfers and, they just say, what are a few things about my swing that I should really be careful of throughout my golf lifespan, just to be cautious of, what are a few things that I can kind of keep in mind?
I mean, I would say definitely the speed that we're swinging the club is a big factor. As we spoke about with the rotation through the spine and the increased chance of injury there. I would always recommend amateur players to slow down their swing speed, because a lot of the time when you're swinging too fast, you're not giving the body time to catch up and make potential corrections. Again, when we're talking about different people with different swings, there's going to be a lot of different abnormalities. And sometimes if, we swing the club slower, it's given the time for the body to make the appropriate adjustments to be able to hit a good shot. But as I said, if we're swinging too fast, then, we're not going to hit a good shot, number one. And then number two, again, a lot of the time it's going to predispose to different injuries like lower back pain, which then can result in the player being out for 10 to 12 weeks. So it's something they want to be kind of conscious of, to make sure that they're remaining healthy and being able to play.
Speaking of being out for a period of time, and I think you kind of got onto this topic a little bit earlier, when should somebody see a PT, a physical therapist, for maybe it's something they call pain, maybe it's a dysfunction that they're having. Maybe it's not pain, but maybe it's something in their swing that they're not getting right. At what point should somebody, or what reasons should somebody say, you know what, I should call Matt?
Mm-hmm. Yeah, I mean, from my point of view, I feel as though everybody can benefit from physical therapy in some way, shape, or form, even if they're not injured. I feel like a lot of people that play sports, at a competitive level or even an amateur level, could do with, seeing a physical therapist for a kind of whole body analysis just to see what, if there is any abnormalities in any areas. Do we have any particular muscles that are tight? Do we have any kind of instability areas that we can work on? So almost from a pre-injury rehab standpoint. But that being said, if someone does get injured, and we're kind of going through the acute stage of the injury, the first kind of 0 to 5 days, and we're not really feeling any better, by the time we get to maybe the end of that kind of first week, then I would recommend getting in for a physical therapy appointment. Because a lot of the time, a lot of conditions just with general rehab, if we can catch them at an earlier point, we can catch them within the acute to subacute stage. It's 10 times easier to get the patient rehabbed and getting them back on the course, as opposed to someone that leaves it for 3-4 months and then they're coming in with a kind of a chronic pain at that point. It makes it much more hard, difficult to remedy.
Almost like the way we treat like the dental field, right? It's absolutely normal to go every 6 months or whatever, just to get your teeth looked at and assessed. If you're starting to develop restrictions in hip range of motion or shoulder range of motion, it's pretty easy for the average therapist to pick up on too.
Yeah.
And I bet a lot of people choose not to go because they're worried you might say you need to take time off, and doesn't always go that well.
Yeah. I mean, that's kind of part of the caveat we touched on. Runners and golfers, they're a little bit, they don't want to take time off. They want to continue to compete and push themselves and train. And sometimes it's an education thing. We need to, we can say, okay, if you choose to go down path A, you continue to play. This probably becomes a chronic problem. Further down the line, you're feeling more pain and you're not going to be able to play. Whereas if you take the time off just now, you commit maybe 4 to 6 weeks, you do the rehab, we get you back 100% and you're back on the course, and then you're injury and pain free for the the rest of the year. So sometimes it's just kind of, you can give them the options and the education, and but ultimately it lies with the patient whether they want to take the advice or not.
Yeah.
Matt, have you seen where like an individual does step away for a period of time, let's say it's a month or 6 weeks or whatever? This individual, obviously, if they're not restricted from even going out and practicing their putting, whatever, do you find sometimes like it's almost like a time they can focus on an element of their game because they can't go out and play 18? They might actually develop better skill from something they can then put time into. You know what I mean?
Yeah. And again, I think that it's about just kind of reframing it in a positive way. Where we can say, okay, you can't play holes at the moment, but you can still putt, you can still chip. So just get out there and practice and commit some time to improving these aspects of the game while we're doing the rehab. And then as I said, it kind of keeps them taking over as well, because they are getting some form of participation, even though it's not playing a full 18 holes. But again, it's like other sports as well. If we have someone come in for soccer rehab or whatever, we want to try and make it sport specific from an early standpoint. We want to try and get the players' engagement to kind of commit to the rehab process. And a lot of the time it is, it's about making it fun, enjoyable, sport specific, and then the players get a lot from that.
There was a golfer recently. I'm trying to look him up. I thought he was South African golfer. Maybe I'm wrong, but he's on the champion. Is it the Champions League? It's what they call the senior league now. He's a little like blonde-haired guy. They call him like the Iron Man because he never missed a tournament, but he busted his ankle and he was out for a period of time. If you read the article, and he was in for PT. They did there was a whole video series on the PGA Instagram or on his Instagram, but it was really cool because he was dedicated to the PT. He was dedicated to getting better. He was okay with taking the time off, and he came back better, stronger, and again, it didn't take long, but he had to commit to taking the time off and committing to the PT. It's a cool story. If you haven't seen it, check it out.
That is cool.
Yeah.
You know what else is, and Matt hasn't said this, Adam, but I find, individuals who really kind of specialize in sports. So let's take golf, for example. I bet that Matt's probably got the mind where like the last thing he's going to do is pull someone out of the sport. He's got ways to modify, to support, to adjust. And that to me is kind of like that's a cool skill that probably even carries over to all your patients, I would imagine, right?
Yeah. I mean, I have a patient that I seen today, and he's a well, he's the manager for the basketball team at FAU. So he's big into basketball, and unfortunately he tore his ACL. So today during the session, he's roughly about 3 months post injury, and we recently picked up Blaze pods for the clinic. I'm not sure if you've seen them. So the Blaze pod. So the Blaze pod is kind of like it's 4 kind of colored pods. And you can basically hook them up to your phone via Bluetooth, and you can set different parameters on the pods for which ones are going to go off, which colors. So from there, it makes the rehab more dynamic. So it brings in the cognitive aspect as well, where we're saying, okay, the pods are going to go off different colors. We want you to just tap the blue ones when they go off. So as part of the session today, I had him dribbling the basketball in one hand while he's working on tapping the pods with the other hand. So it's improving, decision making. It's improving reaction time. He's still working on the sport specific with dribbling the ball, and it improved his buy-in. He was smiling throughout the session. So it was a nice little session we had today.
That's awesome. And you could always, I'm sure putting isn't going to cause too much damage depending on the injury. So you could probably always have somebody go pick up their putter if they have to get their fill on the course. All right. I think we could probably wrap this session up. Golf is a lifelong sport then, it sounds like, as long as you treat your body well and your mind well.
Yeah. I would say, obviously like when we're, assessing golfers, or we're speaking about, longevity, we want to do all the things that are going to be beneficial for us as we're aging, so making sure that we are remaining physically active, we are remaining mobile, we're stretching, we're working on strengthening, resistance training as we're getting older as well, because we know that every decade that goes by we're continuing to lose more muscle mass as we age. Appropriate nutrition, hydration, things that golfers can do before they get out on the course. A lot of golfers, they arrive at the course 2 minutes before their tee time, whereas again, you're kind of setting yourself up for failure. You want to make sure that if you are playing, you get there maybe 20 to 30 minutes before. You can maybe contribute a little bit of time to, some pre-injury rehab type stuff, some muscle activation. I take my HyperX Theragun out on the course with me. So if I start to feel any areas of tightness, I get into it with the massage gun, keep things nice and loose while I'm going round and round too.
Ashley, any tips from you? What do you bring into the course?
Nothing regarding the golf game for sure, but it's such a unique sport, like a lot of sports. It's I think kind of recapping what we said, respecting that it is a very asymmetrical sport, and that the reality is that maintaining regular alignment and making sure that if you're not aware of what that is, that you get to the right people. Either you go to the pro, or if you're dealing with pain or issues, you get to physical therapy, and then listen to your body, and like Matt said, there's no secret there. Stay active, and address what your weak points are. So.
All right. Well, I think we're going to wrap this one up. Next session, we're going to keep Matt on. We're going to start another session. We're going to talk about some of the injuries, and we're going to talk about some of the treatment strategies, and what other questions cross our mind to pick Matt's brain on while we have him. So let's end this session. Matt, thank you very much. Ashley, as always, thank you very much. And we'll see you guys soon.
Thanks, guys.